Hi, my name is Maggie Burton, and this is my remediation skills video for establishing an IV, the primary and secondary fluids and medication. We have all our necessary equipment. We have our badge, uniform, hair is pulled back, nails are free and clear. Here we have our secondary tubing, primary tubing. These have been open just for practice. However, in a real situation, you would not use open ones. We have our alcohol prep pad for cleaning the secondary tubing, gloves, our normal saline, and our amoxicillin, as well as our calculations. And this is our sink, and this is our IV pole here. So we're going to go ahead by washing our hands, putting clean gloves on, verify the patient's name and date of birth. Sir, could you please confirm if you have any allergies or not? No? Okay. Okay. So now we're going to go over the primary tubing. So here we have our spike end, drip chamber. This is our clamp with the Luer lock. This is how we control the medication, the flow rate. And then we also have our adapter end to go into the IV catheter, and then our Y adapter here. Okay, so now we're going to go ahead and we are going to spike the bag of normal saline. This did not touch the floor. Okay, the bag is spiked. We're going to make sure the catheter is in sync. And we are going to put upside down 30 inches above the patient's IV site, which is her peripheral. So this is 30 inches above the patient's IV site. We're going to go ahead and we are going to prime the tubing. Now the tubing has been primed. We're going to go ahead and we're going to go over our drip rate here. So the prescriber has ordered 150 mLs of normal saline for over 1 hour, so 60 minutes. The drop rate factor is 15 GTT, and that equals 37.5 drops per minute. However, you can't do half a drop, so it's going to be 38 drops per minute. So now I'm going to go ahead and I'm going to count for 60 seconds, and I'm going to calculate the flow rate at 38 drops per minute. Okay, now the patient is receiving that the normal saline at 38 drops per minute. Now we're going to go ahead and we're going to go over, the patient is now going to receive amoxicillin, 250 milligrams, which is in 100 mLs. Sir, again, I just want to verify, do you have any allergies? No. Okay, so just to go over the medication, it's 100 mLs in 15 minutes. The drop rate factor is 15 GTT. And that equals 100 drops per minute. Now I'm going to go ahead, before I begin, I'm going to go over the 6 rights of medication administration because we are giving the patient an antibiotic. So it's the correct patient, the correct time. It's 3:30 in the afternoon, which is the time that the prescriber has ordered this med for. the correct medication. It's amoxicillin. The correct route is through the IV, and the correct rate is 100 drops per minute, along with the correct dose is 250 milligrams in 100 mLs, which equals out to be 100 drops per minute. So now I'm going to go ahead and I'm going to take our secondary tubing, and I'm going to spike our bag here. Okay, and now because this is going to be the medication, we are going to go ahead and we are going to move down our primary tubing, our primary fluid here, and we are going to place the piggyback, which is the amoxicillin, 30 inches above the patient's IV site. So now I'm going to go ahead and I'm going to prime the tubing before I connect it. Okay, now we're going to go ahead and we are going to use our alcohol prep pad to clean off the site as well as the Y catheter here. And we are going to connect. To the primary tubing. Okay, now that that's been connected, I'm going to go ahead and I'm going to regulate the flow. So I'm going to count over 1 minute, and we're going to have 100 drops per minute. Okay, now the patient is receiving the amoxicillin at 100 drops per minute for the next 15 minutes. So we're going to ensure that the patient is comfortable. We're going to remove our gloves, wash our hands, and then we're going to leave the room to document that we just gave them these the fluids and the medication through the IV.